Ladies and gentlemen, friends, good morning. It's a great pleasure for me to address you via this video message. Today, as you will begin 2 days of discussions on how to respond comprehensively to drugs and HIV, the world also commemorates the International Day Against Drug Abuse and Illicit Trafficking. It is no coincidence that we kick off this meeting on the 26th of June. It is a way to remind ourselves that when responding to illicit drugs, the issue of health needs to be at the center of a comprehensive response. I would like to welcome and thank you for joining UNODC in Astana today. It is a rare opportunity to have high-level policymakers as well as experts and representatives of civil society organizations from 8 Central and West Asian countries in one room to discuss drugs and HIV. This will make for good discussions, I am sure. I also welcome and thank participants from international organizations, donors, and colleagues from the UN family. And last but not least, my sincere thanks to the government of Kazakhstan for hosting this event and for its unwavering support to the implementation of UNODC programs and projects. Our office is mandated to assist countries in their struggle against illicit drugs, crime, and terrorism. Also, within the UNAIDS family, UNODC is a convening agency for addressing HIV prevention, treatment, and care among people who use drugs and for people living in prisons. At UNODC, we promote a balanced approach to illicit drugs, one that is founded on fundamental human rights. UNODC assists countries to achieve universal access to comprehensive HIV services for people who use drugs and for people living in prisons, following an approach that puts people's health and human rights at the center of our technical assistance provision as we advocate for comprehensive national HIV responses. HIV transmission through unsafe injecting drug use is one of the main unresolved challenges facing the international community. It is largely due to continued high rates of HIV transmission in Eastern Europe, in Central Asia, in South Asia, and in Southeast Asia, as well as worrying trends in parts of sub-Saharan Africa. Unfortunately, these high rates have often been the result of widespread stigma, discrimination, and lack of evidence-informed HIV services, including services for women and young people. Considerable progress has been made, but we still have an immense task ahead of us. The 2011 UNGASS target of reducing new HIV infections by 50% among people who inject drugs by the year 2015 is just around the corner. We need to intensify efforts if we are to reach this target. In this context, UNODC is doing its utmost to strategically use its experts and to leverage its modest financial resources to assist countries to move toward meeting this target. In 2013, jointly with key civil society organizations and other stakeholders, UNODC selected 24 high-priority countries where we have intensified our work, and 6 of them are represented here today: Iran, Kazakhstan, Kyrgyzstan, Pakistan, Tajikistan, and Uzbekistan. The objective is to support you and your efforts to reach optimum coverage of the 9 core harm reduction interventions for people who inject drugs, as recommended by WHO, by the UNODC, and by UNAIDS. Ladies and gentlemen, reaching the UNGASS target will certainly require a shift in mindset and an increase in access to harm reduction services in all high-priority countries, but it will also require considerable investments. Still today, the global HIV spending on harm reduction is just too little to reach the UNGASS target. In 2011, the global HIV spending for people who inject drugs represented only 22% of the estimated $2.3 billion needed annually. International donors account for 92% of that funding. While a large number of countries have increased their domestic investments for AIDS in general, only a few have prioritized the provision of essential HIV services for people who inject drugs. Harm reduction interventions are good value for money. There is compelling evidence of cost-effectiveness for each of the 3 interventions, namely needle syringe programs, OST, and antiretroviral therapy across all regions of the world, with average costs per HIV infection averted ranging from $100 to $1,000. I encourage you to advocate for greater domestic investments for these essential life-saving HIV services, both in the community and in prison settings, and include these interventions in the national health budgets. We know that the absence of an enabling legal and policy environment and supporting regulatory framework continues to hamper effective implementation of these harm reduction interventions. Also, too many people are unnecessarily incarcerated because of drug use. But prison is not a treatment of drug use. Instead, prisons increase the risks of HIV transmission among the prisoners as well as the broader community. We all have a role to play in ensuring that policy and legislative changes required in countries do take place. In that context, I also encourage you to advocate for investing in alternatives to incarceration for drug use. The world can only achieve the UNGASS target by ensuring that the needs of one of its most vulnerable and affected population groups are met. We have the science on our side, we know what needs to be done, and now it is a matter of putting together science, public health, and human rights considerations in all drug-related responses. We can literally save thousands of lives. On these words, I wish you all a productive and fruitful conference. May the outcomes of your discussions and the key messages of this meeting find their way back home and into your communities, and may they spark changes to ensure no one is left behind. Thank you for your attention.